Today, we have a new record high number of cases who have tested positive, 139 people in British Columbia, bringing our total to 6,830 people who have been diagnosed with COVID-19 here in British Columbia. That includes 2,343 people in the Vancouver coastal health area, 3,551 in the Fraser Health region, 187 people in the Vancouver Island Health region, 642 people in the Interior Health region, 203 people in Northern Health, and 84 people who normally live outside of Canada. We now are up to 1,412 active cases in every health authority in the province, of whom 42 people are in hospital, 14 of whom are in critical care or ICU. We have no new deaths to report today, leaving our total at 213. We now have continue to have 3,109 people now under active public health monitoring because they have been a close contact of a case, and we have 5,190 people who have recovered from COVID-19. We have no new healthcare outbreaks to report. There are 16 currently active in our healthcare system, 13 in long-term care or assisted living, and 3 units in acute care. And we're up to 773 people, 466 residents, and 295 staff who are involved in those outbreaks. And while we have no new community outbreaks to report, there are continuing ongoing exposures in many communities around the province, and we encourage people to check regularly with their health authority websites for alerts and guidance around community exposure events. Living with COVID-19 in our communities is the challenge that we are going to face for the next months, maybe years, and we need to continue to find a balance. This balance requires us to do what we need and everything we can to protect ourselves and those around us, but to ensure that we also have those activities that we need in our communities to keep going. Since the start of the pandemic, we have adapted and learned many things, and we've created a new normal that we are now living in and will need to continue to live in. It doesn't stop here, though. We will continue to learn and adapt as we move forward and to make adjustments. And what we have tried to do and what we will continue to do is make adjustments where we see that exposure events continue to happen where risk is. We know what we need to do to keep ourselves and those around us safe. And now we are getting ready for what may lie ahead as we head into respiratory season, as we start to go back to school and back to work. We need, and this is our time, to be steady in our actions and ready for what lies ahead. This is the time to use our layers of protection that we know and to always stay home and away from others if we are feeling ill ourselves. Today, for many, many children around the province, it is the start of school, the first day back. And I know for many children and families this can be exciting and anxious, no more so than this year, as we and millions of children around the world are going back to school in the midst of a global pandemic. I remember what it was like for me and my sisters as when we were young. But it's also a time where we all need to step back and set those new routines for our new school year, for the new phase that we're moving through. Over the past few weeks, education leaders, teachers, public health experts, all of us have been working together to create the new rules for school to reduce the risk of COVID transmission and, importantly, allow everyone to get back to that all-important in-classroom learning. As is the case for every school and every school district, public health teams are ready and will be there to support your school community as we need to going through this. And like we have in every previous year, we'll be there if a communicable disease arises that can spread to others. And we know we've had those in the past. We've had measles, we've had meningitis. We will deal with COVID as well. And the school community will know and be alerted. And if there's the potential that risk goes beyond the school, then the public will also be notified. These are protocols that we have used in the past, and we have updated them and made sure that we are ready to support every school community, and every community in BC as we go through this pandemic school year. We will be announcing, as we've mentioned before, any school outbreaks as well, so that everybody knows what is going on as our school system goes back to normal, our new normal, and our new school. I think it is important for us to recognize all the work that has been done by educators, by our teachers, principals, the parent-teacher associations, the school districts, to get schools ready this year. And it's going to be a learning experience. Today was day one for many children, and we will all be learning over the next few weeks. And we'll be doing this together and working together to control a common foe like we have with this COVID-19 builds our resiliency and is what will get us through. It is incredibly important about keeping our community wellness and finding that balance. That means keeping our communities healthy and resilient, about using our layers of protection and staying safe. It's also about keeping those important activities that are safe going as well. It's equally important for our social, mental, and economic health. Every day we learn about COVID-19. We know about the sources of transmission, the actions we can take to protect ourselves. And there are many, many resources that are available to guide people's actions, and I encourage you all to make use particularly of the BC Centre for Disease Control website as your source of truth. I know there are many, many things that are out there, particularly on social media and on the internet, and the source of truth can help you find where to look for that information. What we are, all of us, every single one of us does today makes a difference. It makes a difference tomorrow. It makes a difference in the next 2 weeks, in the next incubation period, and for our future. By choosing to wash our hands regularly, by choosing to keep our social interactions small and with those we know, and always, always staying home if we're not feeling well, we will ensure that we remain strong here in BC. So let's all make those right choices that will help to keep our cases of COVID-19 low and continue to allow us to engage in those important social and economic activities and school activities that we need. We need to work together now to push our curve back down. And more than ever, we need to remind ourselves that we can do this, and we can do this by being kind to each other, by remaining calm and steady in the work that we do, and by staying safe. Thank you.